This presentation is about the O-arm surgical imaging system. So exactly what is the O-arm? So the O-arm, it's a mobile intraoperative system used for 2D and 3D imaging. It combines both C-arm and CT functions. So the C-arm aspect of it, the 2D imaging, you can use single shot exposure or live fluoro. So for single shot, you push the button one time, there is your image. Or if you need live fluoro, you hold the fluoro button down and it gives the surgeon a live fluoro. The 2D aspect of the O-arm is also used for localization and verification. So what that means is, say a surgeon places a needle into a patient's spine and needs to know what level he's at, you can take a 2D image, aka a C-arm image, to give him that information. So the CT function aspect of it, or the 3D imaging, gives you a 360-degree scan at 192 slices at 0.4 millimeter slice widths. So you get your axial, coronal, sagittal, and oblique images. The cool thing about the O-arm and its main purpose is that it's interfaced with this navigational system by Medtronics. The software is called the Stealth Station. So whenever you take a 3D CT scan, you transfer this data onto the Stealth Station so that the surgeon can use that data to place instrumentation, and I'll go over that in a little bit. This 3D scan is used only in complex cases, complex orthopedic, spine, and cranial surgeries. You do not want to be using the O-arm for your basic surgeries. So how does the O-arm work? So whenever you're utilizing the O-arm, you want to be mindful about being sterile. So whenever you bring the O-arm in, as you can see in the video, over the patient, you want to make sure that you're not closing this thing around the patient or touching any of the sterile drapes. It's best if you have someone to help you make sure that you're not closing in on a drape or hitting anything. There are still drapes for the O-arm. I've never used one, but I know that they are available. So whenever you close the C-arm, the O-arm around the patient, you can either at that time perform your standalone 2D images, your live fluoro, or your 3D scan. Your 3D scan is also referred to as a spin. So for the 3D scan, is what will need to happen is the surgeon will need to place a tracker, and it's this thing with these balls. We'll need to put it onto the anatomy of the patient so that the O-arm and the Stealth system can recognize the patient's anatomy. So this is what the Stealth system looks like, and this is the boom. So in conjunction with the O-arm, the boom, and the trackers, it gives the doctor a real-time 3D scan of the patient. Once you obtain your 3D scan, all the images are transferred here to the Stealth Station, and they're available immediately for use. So the O-arm, console, monitor, and exposure button. So the control panel has 57 button features. It's a lot. So for me, I make a cheat sheet on the O-arm that I use for the buttons that I use over and over again. I'll just get a piece of tape, write what it means, and just put it along there just to help me out. There's also 3 different mode settings. So here's your 2D, your multi-2D, your M2D, and your 3D. So you also have your exposure button. This is what it looks like. So top button is for 2D and live fluoro. So live fluoro, hold down one exposure, push it one time. Here is the button for M2D and your 3D, your scan. And this is the safe button, which is also located here on the console. This is what the O-arm looks like. Here's the console, monitor. You can toggle between your 2D and 3D images here on the screen just by pushing 2D over here or 3D. It also comes with a keyboard, mouse, and a monitor. So here's what 2D mode looks like. So it, once again, performs like a C-arm. Images are in 2D. You can do your APPA, oblique, and laterals. You just hold the button down to go to lateral or perform the oblique that you need to do. So in order to prevent this collision zone that I have here in my pictures, you want to make sure that the O-arm is up high enough and extended out. So when I took these pictures, I did not have the arm up and out far enough. I didn't do that, I just took the pictures. So that's what that means. So holding down the exposure button will allow you to have your live fluoro shots. You can also adjust your KV and your MA. You also have really cool features on here to increase your image quality and reduce radiation. So here's your noise reduction. So you would just push this, auto brightness, and then here you can use low level radiation, and here's some a laser button to help guide you. So M2D mode. So M2D is just a mode that's used for memory function. If you need to do some kind of crazy angle like 20 degrees caudal, 30 degrees RAO, and the surgeon tells you to come back in with the O-arm and do that exact same view again, well, before you pull the O-arm out, you want to hit M, and then you can store it on 1. So whenever you drive the O-arm back in and you need that radical position, you just hit M and 1, and it will move the O-arm into place for you. You also have 4 memories that you can use. So you can store up to 4 different positions on the O-arm. P is for park. So if the surgeon says, get the O-arm, up and out of my way, I need to work on the patient, move the patient up, store this memory as park. So next time you come back down and take images and he says, okay, move it up and out of the way, you just hit M park and it will put it back up to where you had it. So here is 3D mode. The screen looks a little bit different on here. So 3D mode, once again, it's performed as a CT scan. So before you are able to do your 3D scan, you need to make sure, just like you do in CT, you need to take scout films. You need to take a APPA and a lateral to make sure that you're getting the anatomy into the image. You need to make sure your patient orientation is correct, that this matches exactly how your patient is laying. You also need to select a part. Which part are you going to be scanning? You can pick the head, the T-spine, chest, and you can move on down to the part that you need. You also have HD, low dose, and standard modes. So HD is when you would need a technique where a patient has a bunch of artifacts. So the HD mode is going to help clean that up for you. Low dose will be for pediatrics or a smaller part, and standard is just your basic run-of-the-mill technique mode for most cases. So whenever you are ready to do your scan, there are green lights that appear on the boom, on the stealth station, and the O-arm, and you want to make sure that all 3 of those are green, and that means they're all communicating in order for you to do your scan. So whenever you go to do your scan, you hold down the 3D button, and depending on what you chose here, HD, low dose, or standard, the scan could take between 13 to 26 seconds for you to get that scan done. So what do the images exactly look like? So this is what a scan would look like without any hardware in. This is the scan here in picture 1, where you come in and you take your scan so that the surgeon can use this data to place his hardware. So as you see here in picture number 2, this is the monitor on the stealth, and these blue markings is the surgeon actually putting a screw into the pedicle. So they can see based off of your scan where they are exactly putting this pedicle. It's really awesome. Picture 3 here is after all of the screws are put in, you can do another scan, and that way the surgeon can look and see exactly where the screws are, and this can all be done in the operating room, which is really awesome, because if there's anything that they need to fix, they can realize that at this time and go in and fix it. So radiation exposure, you need to be mindful of where you stand. The safest area, as you can see here, the 3 is behind the O-arm control. So you want to be standing right here. The unsafest area is around the patient. This is where the numbers are the highest. So as you can tell, distance is our friend. So we really need to be standing back whenever we're using the O-arm. Educate staff on this. Have lead shields in the room for people to stand behind, even yourself. And if possible, have everyone that's non-essential in the room for your scan to just step out of the room. The benefits of using the arm. They meet the workflow demands of the surgical environment. You have your C-arm portion of the O-arm, and you also have your 3D scanning. It allows for surgical precision. They know exactly where they're putting in that hardware. The hardware that you're putting in is in real time. It is exactly how the patient is laying, which prevents errors. So the system also eliminates the need for surgeons and staff to wear lead during the entire case. They can just step out for your scans, or they can step behind the lead shield. It provides current patient data in the OR just as they are positioned for the surgery to happen. And this also reduces surgery time. The surgeon can fix their mistakes easier by looking at the scans. They notice something's off. A lot of times you take post-op films after, a few days later, like on a spine surgery, and then the surgeon notices, oh, I need to go back in and correct the screw placement. Well, no, with the O-arm, they can go in before they even close the patient and fix these mistakes. The technology tool that I used was Kahoot, and I used 3 of my assessment questions on this program. So this is me actually taking my test on Kahoot. This was really fun to use. So first question, let's see, 3 questions. Are you ready? Yes, we are ready to go. All right, question 1. Which type of surgery would be most suitable for the O-arm? T11 L3 spinal fusion, cholangiogram, cystogram, pinning of a supracondylar fracture. Well, as we know, the O-arm is used for complex cases, so we would definitely be using this for a T11 L3 spinal fusion, not for a cholangiogram. We could use this C-arm for that. Same with the elbow and a cystogram. No need for the O-arm. All right, so let's see. We got that one correct. Awesome. Okay. O-arm can function as a C-arm. Okay, well, we know that to be true, that the O-arm can function as a C-arm, can function both as a C-arm and as an O-arm 3D mode. So answer to that is true, and we got it correct. All right, awesome. 2 for 2 here. We got 1 more to go. The O-arm can do all of the following except. Ooh, these are usually pretty tough. All right. It can do all the following except create a single shot exposure. Yes. Perform an intraoperative CT scan in 2D mode. Ooh. Eliminate the need for the surgeon to wear a lead apron. Correct. Can be used with software to assist in instrumentation. Correct. So it cannot perform an intraoperative CT scan in 2D mode. It can only do that in 3D mode. So that one is incorrect, and we got it right. So that's awesome. So we were 3 for 3. So that is my presentation on the O-arm. I hope you enjoy it and got something out of it. Thank you very much.